Good morning, LinkedIn. Claire Henson-Bone here from Bespoke Wellbeing. I'm joined this morning by the lovely Chrissy from HCB, and we're going to be talking all about long COVID and in particular return to work. So we'll just do some very quick intros before we get going. So my name is Claire. I'm company founder at Bespoke Wellbeing. We are an occupational health physiotherapy company, and we specialise in return to work planning, rehabilitation for staff who are injured and want to return to work. We also look at DSE and ergonomics, and we also have a long COVID rehabilitation programme. Chrissy, can you just introduce yourself? Is that okay?
Yes, absolutely. Good morning, everyone. Good morning, LinkedIn. Yes, my name is Chrissy Clark. I am the head of clinical services at HCB Group. My background is in nursing, but I've worked for HCB and worked within the vocational rehab sector for the last 4.5 years now. Can't believe it's gone so quickly.
And we met last January, didn't we? January 2020, before the chaos ensued.
You could have foreseen what was going to happen.
We had a cup of tea, I know. Well, thank you very much for joining us this morning. So we've got a few kind of key things we're going to touch on today. So if anyone who's listening or watching on the replay has any questions or any thoughts at all, please do pop them in the comments, and we'll come back later as well, Chrissy, won't we? And just have a look if anyone needs any help with anything. But first of all, could you just talk us through, Chrissy, because HCB have put together an amazing kind of assessment and treatment program pathway for long COVID, haven't you? And it'd be really helpful to just understand maybe how that came about, why it was put together, and sort of how it kind of works. That'd be really helpful, I think, just to start off with.
Yeah, absolutely. Thank you. So what became apparent to us after the initial months of COVID and the initial wave of infections started to subside, and we saw a lot of people recovering, thankfully, from COVID. We started to see a small but significant proportion of the clients that we worked with who weren't recovering as quickly as we would expect, and also the symptoms that they were exhibiting might be different to their initial COVID infection. And seemed to be a lot more debilitating than their initial COVID diagnosis had been for them. And this really kind of came at the same time as there started to be more and more discussion about this thing, long COVID or post-COVID-19 syndrome, whichever term you want to call it. I hope everyone's okay. I will stick to long COVID because it's just shorter and a little snappier to use. And so at that point, we really wanted to look at what our standard assessments and our standard support could do for those people. But we recognized that there was also a gap in support for people. And I think that certainly kind of fitted with the NHS picture of some areas of the country. People got long COVID clinics set up quite early, and it contained diagnostics and therapies. Other areas didn't have any provision at all, or they just had a provision for a diagnosis, and then people were kind of left to join waiting lists. And so knowing what, and Claire and I have spoken a lot about this in the past, the kind of the 6 months post initial absence, that kind of ticking clock of getting someone back into sustainable work, we really started to think this is something that we need to be able to offer to our clients to really maximize that support and that treatment early on to get that person back to the point they would like to be at, particularly returning to work. So with that in mind, we've worked with Claire and Bespoke Wellbeing and a mental health partner and a virtual GP service to really try and map out and meet the needs of most of the people who we've supported through the long COVID pathway so far.
Perfect, thank you. And it's not easy, is it? It's not the return to work planning a process. There are lots of things to consider in a everyday injury or health conditions, pre-COVID, pre-long COVID. It isn't easy when these barriers creep in and people have symptoms that maybe aren't controlled or they fluctuate. So I guess the next question is around how is it different? So what is it like? So you've had a lot of people through your kind of pathway now. How does it differ trying to support someone with long COVID back into the workplace versus, say, a standard sort of musculoskeletal issue or a health condition? Where are you seeing those differences?
Yeah, it's a really good question. What we're noticing is the vast majority of the people that are going through the pathway haven't necessarily had poor health in the past. And so for a lot of people, I think confidence is a huge barrier for them. If you're someone who's very kind of fit and active, and we've had a couple of people who are marathon runners who then struggled to walk to the bottom of the garden and had to have a kind of a sit down before they could get back to the house. So there's been a lot of a lack of confidence in their own bodies, and also with long COVID, which I've never seen in a condition before. Symptoms from one day to the next can vary massively. One day someone can be feeling not too bad, and the next day a completely new symptom or a symptom they've not seen for a while will suddenly become a significant issue for them again. So that's been more tricky. And also, I think kind of the fear for that person and the unknown for them. It is a new, COVID-19 is still relatively new to us. Long COVID is still this kind of amorphous entity that we're really trying to get to grips with and to understand what it is and how it differs from the likes of kind of chronic fatigue and that the other terms that kind of fit under that umbrella of conditions. So I think the fear of the unknown and the lack of experience of being unwell in the main people that we've seen really struggling with long COVID have been significant challenges. I think we're all pretty comfortable these days with kind of a musculoskeletal condition. People are pretty active and staying active for longer. And so if you have a back sprain your ankle, whatever it might be, everyone will know someone who's been through that and who's been through the support to recover, and they've seen people recover. So there is that, I think there is, again, comes back to confidence. There is that confidence that they will get better. Whereas with long COVID, sometimes it can feel a very, very long journey with an uncertain outcome.
That's really interesting, because I'm just thinking of some people we've seen to support your programme. Some people have pre-existing health conditions that maybe they've been self-managing for a while, and maybe, you know, with the long COVID they've been exacerbated or they've got new symptoms, but they do have some of the self-management skills with sort of long-term health condition brings, and what, you know, you naturally would learn over time. But then we're also seeing on the flip side people that, you know, as you say, they've not really had anything like this before. They've been fit and well, they've been hiking, they go running, they work, you know, a zillion hours a week, they go type personalities, and now, you know, they're experiencing very long-term fatigue and other symptoms that come with long COVID. And from the people we've seen, that seems to be it's really difficult, and as you say, that confidence is very low, and that expectation of prognosis is unknown. So people are worried, aren't they? And I think sometimes that we talk a bit about acceptance, don't we, and sort of that learning these new strategies to support things, and that, I think that's part of it, and to build that confidence back up. It's really interesting, the different types of people that we're seeing.
Absolutely. And what your team have been wonderful in doing is, as you've kind of alluded to, setting those expectations for people, and really unpicking with them what pacing yourself really looks like. And sometimes it isn't kind of mind over body. The two things have to work together. So you can be incredibly motivated, but if your body's just not there at that point, it's okay to just recognize where you're at that point in time, and there will still be things you can do, but it's just setting those realistic expectations. And the feedback I've had from our clients who have been down the pathway and who have received the support from your team, that's been a really important factor for them.
I'm going slightly off on a tangent, but it comes back as well to that fatigue versus deconditioning part of the assessment, because the way that we manage the deconditioning and the fatigue are very different approaches. So the normal sort of medical rehab doesn't work with the fatigue. We look at managing it in a different way. Whereas if someone's just deconditioned, you kind of go through that kind of strengthening, conditioning, endurance type training from a physiotherapy perspective. I think some patients that we're seeing that haven't had to manage long-term health conditions or fatigue before are something like, well, if I just push and keep going, my mind is saying I'm motivated, I want to do all the things I love to do, but then they feel really awful, and the fatigue is very uncontrolled. setting those expectations and talking through, what are the strategies, because they're different. Just you were talking there, just made me think about it. And you also spoke there about the confidence and the unknown, and as you said, patients are worried. I saw an article in the Daily Mail yesterday, and I sent to the team about a celebrity who was saying that he'd hidden his long COVID diagnosis. He'd had it for about 10 months, and he sort of didn't say it to anybody because he didn't want it to affect his work. He didn't want people to say he couldn't work, or jobs that would come up he didn't want to be not considered for because of his fatigue and long COVID. And I think part of that is because people, they don't know that sort of the long term, the prognosis, and particularly from our perspective, we're very careful the way that we talk about our rehabilitation program, because sometimes some of the patients you sent through to our program, they'll say, "Oh, I'm here because you're going to cure me." Well, actually, no, we're not. We're not going to be able to cure you, and it is still early days. And we have to be quite careful what we say to people, because we don't know. It's still very early. We're getting great successes, and I'll ask you about those, what we're finding so far. But as you say, we haven't got years and years of experience. Nobody has, of experience, of data, of research. So we're learning all the time, and keeping your finger to the pulse of what is happening in the world of long COVID is, if you don't keep, a few weeks can go past and it's changed. Things have developed, haven't they? Subcategories have come up, and tier systems and things. So it's a very interesting area of work. We have to be quite careful, I think, about setting that expectation and collecting the data, and so we can share and learn from programs such as yours. So I guess the question to you is, what kind of successes are you finding? People that are coming through the assessment treatment program that you put together, because it is great and it is a multidisciplinary approach, isn't it? So what kind of successes are you seeing? What changes are you seeing in people?
Yeah, and thank you for recognizing. Yeah, it was intentionally designed to be multidisciplinary, because it is such a kind of a broad palette of symptoms. I think at one point they'd mapped it at over 100 symptoms that kind of sat under this umbrella of long COVID, and it'll be interesting to see kind of how that develops over the next year or so, and whether it gets broader or whether it gets a little more narrow. And just going back to your previous point of people wanting to be cured, or wanting to be 100% well before they could go back to work. And I think, again, you and I have spoken about this, Claire, and are agreed that you do not have to be 100% well to be at work. So yeah, absolutely, there is that setting of expectations there. Interestingly, we had a couple of people who had tried to kind of go it on their own with their long COVID diagnosis. And so by the time we got the referral through to the pathway, they'd already tried by themselves to get themselves back to work, just through kind of, pushing through, and it hadn't been successful for them. And one of those, I think he's a really good success story to talk about, because by the time he came to us, his self-belief, or his belief that he could get better, and his belief that he could return to work was very low. I think we're talking about probably about 1 out of 10, his belief that he could actually get back to work. And it really came back to, yes, his symptoms. He was quite short of breath. He did have quite significant fatigue. He had kind of generalized kind of aches and pains. But I think his main barrier at that point was his mental health. When he tried to go back, it hadn't worked, and he admitted he felt very, very low. He never felt that way before, so he didn't have the strategies to pace himself and to work through the breathlessness safely, and to gradually improve his lung capacity and his kind of cardiovascular effort. But he also didn't have any emotional health strategies to manage the feelings that he was going through. So when he started on the pathway, once we made the initial assessment, and thankfully he developed a very effective rapport with his clinical case manager from HCB very quickly. And I think part of his success was he was so open from the beginning about absolutely how he was feeling. And so we could really understand kind of all the aspects of support he needed. But then we referred him at the same time through the mental health and your support. And that multidisciplinary work, it worked really well. But I know from the case manager, she really appreciated the updates that she was receiving. So she knew how to, from your team, so she knew how to support the chap really to stay engaged with the program. I think he was on the program for about 4 or 5 months, and gradually then, when the time was right, we started a sustainable, slow, graduated return to work, and he's now been back at work full time for 2 months, and he's absolutely delighted, and he said, I never thought I would get back here, and I'm so pleased I have my life back. And that's just such a powerful thing to hear from someone, when you saw how low he was, and kind of physically and emotionally, at the beginning of his journey.
I always think there's nothing, I mean, I've worked in occupational health for a long time, I always think there's nothing worse than a failed return to work. It's one of those things, like nails on a chalkboard, when someone says it, I'm like, oh no, because it's when people go back to work and they're not prepared or ready, or say whatever it is, and it's sort of set to fail, and then they fail, I just think it's heartbreaking. It's not good for anybody, really. It's not good for the employer, because obviously they're trying to plan the workload. It's terrible for the employee and their mental health and other symptoms. They may be, I know COVID and triggering on absence management might be variable, but that they can then be triggered again on their sickness absence policy, and then the symptoms have flared, the clinician then struggles. It's so tricky, the failed return to work. So I think something like your program for long COVID is great, because actually, like you say, they've got their case manager who sort of oversees everything, don't they, and help put that kind of return to work plan in place, and the advice and recommendations back to the employer. And then, as you say, you've got the multidisciplinary team looking at the physical and mental health of that return to work, and controlling those symptoms. So it works really sort of seamlessly and really nicely. We talked earlier about the differences between return to work for long COVID and other conditions and injuries. What are you seeing? Like, this might be a piece of string question, but what are you seeing in terms of timeframes for a phased return to work? So phased return to work, for those who don't know, is when someone goes back to work on adjusted hours for a short period of time to help pace them and ease them back. And typically, would you agree, Chrissy, it's usually 4 weeks to get them back to full-time working, and that's usually because of pay and their processes and policies internally. So what are you seeing with long COVID? Are they getting back in 4 weeks? Is it taking longer? What kind of timeframes? Is it a piece of string question?
I'm going to be annoyingly vague here, and I apologise in advance, but some people are able to follow the 4 week kind of the almost kind of standard 4 week pathway with amended duties, if that's appropriate, and if it's something that the employer can facilitate and something the employee wants. So kind of amended duties, amended hours, and they go from week 1 to week 2 to week 3, stepping through effortlessly, and then they're absolutely fine at the end of week 4. But differently from our usual return to works, we are seeing there are some people, they get to a certain level, so they might have gone through the first couple of weeks fine, and then they seem to be hitting a bit of a wall. And that either means they're kind of taking a step back, so they're noticing that their symptoms are coming back, or they just think, I am working as hard as my body and my cognitively I'm able to. So at that point, we're lucky we work with some very supportive employers who genuinely value their staff and want them to succeed in their return to work. What we're finding is we might have to either hold them at that kind of week 2 level for another week or 2, just to see whether they can kind of get used to being at that level again before we take another step up, or that the step between week 2 and week 3 was probably a bit ambitious, and we find kind of a middle ground, because for some people it's really important, they feel that they're making progress, but we just need to slow it down. So in some cases the return to work is more of an 8 week than the kind of standard 4. I think the main thing at the moment is that the employers that we're working with, there's no hard and fast rule. They're in general, as long as they can understand why we're needing to change what the return to work looks like from the usual, there is that flexibility there for people. And as I said, it's not everyone, but in those particular cases where there's a lot of what we call brain fog, kind of cognitive cognitive quagmire that these guys are trying to work through. That's my word for the day. But yeah, where it's really hard work for them and they're in cognitively demanding jobs, it's the right thing, I think, to just take a breath and carry on at that level. So they're not taking a step back, but it wouldn't be right to push on just because that's what we'd agreed at the beginning of the steps back into the workplace.
And are there any things for those that do maybe take a bit longer to return to work? Like, is it more like the job role, so more cognitive function, more physically demanding, or is it related more to symptom type, so fatigue, brain fog versus shortness of breath, or severity of symptoms, or is there just no pattern? It's a long COVID.
In general, there's not a hard and fast rule, but I would say it's the main difficulties that people report when they're worried about taking that next step up are the cognitive impact of returning to work and fatigue. The shortness of breath we're seeing in general, once people have been through the pathway, we don't tend to see a flare up of the shortness of breath symptoms at the moment. But with the wonder that is long COVID, never say never. But the main thing, I don't trust anything with long COVID in terms of feeling like you've knocked a symptom completely on the head at this stage. But no, in general, it's the cognitive difficulties and physical and kind of cognitive fatigue is the kind of overwhelming one that people struggle with the most.
Perfect, thank you. And so say I'm an employer, I have an employee who has had the acute stage of COVID, they've recovered from that, and now they're struggling to return to work. They've got some of the common long COVID symptoms. I don't know, say they're fatigued, short of breath, and some brain fog, and that we haven't got a return to work plan in place. What would be the process to come into a specialised pathway? What would I need to do?
So, I mean, in a lot of ways, long COVID, we shouldn't treat it any differently to other conditions, in that you could go to our website, which is hcbgroup.co.uk, and either speak to myself or one of my colleagues just to have a kind of a discussion about whether it's appropriate to put a referral in at that point. Or you could just refer directly into us at that point by going to the website and contacting us directly. And then what would happen is, assessment-wise, it wouldn't be any different from doing a referral for any other condition. The HCB clinician, so we have a team of OTs, a couple of physios, and a nursing, a group of nurses who work with us. We would make that kind of, it's a fairly extensive initial assessment, and then from there decide whether it was appropriate for the person to be on the pathway. And if it was, we would discuss with the employer what we would like to do, so that the employer feels completely confident that they know what's happening with their employee, and what the timeline is potentially going to look like. Because we know from years of doing this that a sustained return to work, it has to be a partnership between the employer and the employee, with kind of vocational rehab kind of sitting in the middle, supporting both sides with that. But first step would be to go to the website and then take it from there.
Is there a referral form on the website, or is it more making contact and then they'll be sent a form, or do they want to make a referral?
It will be at the website you can make initial contact either with myself or with our operations team. If you're happy, that if the employer is happy, no, I just want to put a referral in, they can speak to the ops team who will send them out the referral form, and then our case manager would be in contact with the employer to discuss their needs, and a bit of background of the case. But as I said, a lot of employers, particularly if it's their first time using the service, they like to speak to someone about the referral first. And then the website's the best place to get hold of me to chat it through.
And you mentioned there, looking at whether people are suitable for the pathway in the programme. In that assessment, are there some cases that you see, the long COVID cases that you see, that actually they aren't appropriate and they need more medical kind of sort of assessment? Or
yeah, absolutely. For a small proportion of people who are experiencing long COVID symptoms, we're seeing more kind of cardiac related conditions which really need to be explored by a specialist before we're confident that a rehab program is the right thing for them, which is why we have the virtual GP service as part of the pathway. Again, the NHS is wonderful. Having worked in it for a very long time, I'm still very fond of it. But in some cases, waiting lists for, or even just to speak to your GP, can seem kind of an insurmountable obstacle. But then the waiting list to get those specialist assessments and kind of sign off from the appropriate specialisms, it can be a very, very long wait. And again, as long as the employer and or the employee are happy for that to happen, we can then ask our virtual GP service to make those initial GP assessments and to refer into the appropriate specialisms at that point. And in a lot of cases, we've just needed for that person to have a review with a kind of a cardiac specialist in it. That's the example I've already given, and for them to say, I'm happy for this person to start on a rehab program, or in other cases, it's been actually no. There's something here that's not quite right, and we need to actually really look at it before we put any stress on that person. And so in that way, we can feel confident that we're doing the right thing by that patient, because absolutely patient safety is key to everything that we do, really.
Yeah, absolutely. Well, thank you ever so much, Chrissy, for your time. If anyone watching now on the replay have any questions or comments, do put them below, and we'll come back later on, won't we, Chrissy, and have a look. But thank you so much for your time. It's been great having you.
No, thank you very much, Claire. It's my first LinkedIn Live, and I've really enjoyed it. So thank you for the opportunity.
You're very welcome. Bye, guys.
Have a good day.